Let's talk now to Dr. Nik Johnson, paediatric hospital-based doctor in Cambridgeshire. Nick, a very good afternoon to you. Welcome.
Good afternoon, Mike. Thank you for inviting me on to talk.
Not at all. Thank you very much for joining us. We hear from an awful lot of virologists. We hear from an awful lot of doctors in various different roles in the NHS. You're specifically a children's doctor, and obviously we've been very concerned. I mean, I've got 2 teenage kids myself. We've all been very concerned about how they're coping with not being at school at the moment. From a sort of medical perspective, what are you seeing where you are?
Well, I think you referred to it in the trail for this. Collateral damage, I think, is the point that we are seeing with the paediatric population, and that's across all age ranges, from the very young to the teenage age range. To cut a long story short, there has been increased levels of mental health distress, and in particular areas, an area that was highlighted by the Royal College of Paediatrics was that of food restriction and anorexia is one thing we've seen rocket in terms of its presentation,
right.
As well as at a level of things like low mood, moving on to depression and anxiety. It's very much the collateral damage as you've described.
Yes.
And I do worry that the children have been they've not necessarily been forgotten about, but it's been a kind of an easy move to try and solve the problems of the wider COVID pandemic, and the needs of the children and the paediatric population have not always been recognised, hence the reason I wanted to speak out today.
Yes. Yeah, I mean, I think there is a sense, is there not, in some parts of government that the kids will be okay, they're very resilient, they're much more resilient than we know that they are, and they can adapt to all kinds of things. But I mean, I've been talking to lots of parents over the course of the last year, really. And, for us, for example, we've done things in life, we've travelled, we've been places, we've had jobs, we've had responsibilities. For a lot of these kids, particularly kind of young teenagers, they're feeling kind of lost because they haven't done anything and they don't know whether they ever will.
Yeah, no, you hit the nail on the head. Inevitably, that feeling of a lack of control over your life from things that you have been doing on a regular basis, be it the routines of going to school, the routines of extracurricular activities, and the benefits you get from the buzz of meeting, socialising, and participating in exercise. They've been taken away, and there is an element of feeling people, adults feel it as well, but the children are just as much feel bereft, and they have their own concerns about fears of infection. One of the maybe brighter points in the COVID pandemic has been that maybe the numbers of children affected seriously have been relatively low, but that doesn't mean to say that they've not been scared as much as the older and their own population and the parents.
Yeah, and also they may well be worried for their parents or for their grandparents or their elderly relatives, because we've got this constant sort of barrage of propaganda from the government saying, if you go outside, you might kill your granny, or you might, cause somebody to die. And I think that's really misplaced.
I would recognise that. I know children have been worried about, parents like myself going off to work, but it's also true, people who are on the front line, be they working out in, supermarkets as school teachers or in the prison services, parents going out to work on the front line, just exposure to going down to the shops. Children have been concerned, and that's promoted anxiety and low mood.
Absolutely right. And a lot of parents as well, I think, are struggling, and you'll probably know this better than me, Nick, in terms of, they're not really destined to be teachers. They don't really are. I mean, it's probably sounds silly to say it for people who don't have children, but a lot of parents are not equipped to look after their own children 24/7. They need them to go to school. They need them to learn and to mix with other people, and it must be quite stressful for a lot of people.
Absolutely. Parents, maybe just want to be parents. We don't necessarily always want to be teachers. And if there's one thing that's come out of this, I speak as a frontline NHS worker. I was so grateful that my children have been able to go into school. I mean, be it called COVID school, the COVID kids, but it's only through that the support of those people supporting our kids and allowing some continuity for their lives that I've been forever grateful. I absolutely recognise the challenges for children who, particularly children who are on their own at home in more challenged socioeconomic situations. But the idea that we can all sort of turn a hand to undertaking education and all the complexities of that. If there's one thing I guess I've recognised from my own friends and sort of socialising is that the teaching profession has got a whole load of more respect because of the ability they have to do to help our children, in loco parentis.
Yes, it's very true. And I know many parents, and I could probably count myself among them, who at times over the last year, I mean, one of my sons was due to do his GCSEs last summer, and so therefore didn't really have anything to do, had no homeschooling or homework to do when schools closed after Easter, because he was more or less going to be revising for his exams, which never happened. He then got, the imaginary grades that he got, and he did quite well. But even saying that makes no sense, because they just made it up, and it was great. But I mean, it's very difficult to motivate him if he feels unmotivated, because I can't convince him to go and study if he doesn't feel like it, because I don't want to mess up his head.
I think we share a very similar sort of demographic with our own families there, Mike. Yeah. So I can acknowledge that 100%.
Yeah, I mean, so I mean, without wishing to sound smug, you and I are probably at the upper end of educating our own children, and not everybody is able to do it, never mind willing to do it. And an awful lot of kids, I'm sure, and it's being said that an awful lot of kids in lower income households are really suffering.
You hit the nail on the head. I mean, it has the effects of COVID-19 and how we've had our social isolation, the reliance on our education. It is much more affected negatively those in the socio-economic age classes. It's also in the terms of the actual health outcomes, but it is of particular concern to paediatricians like myself that the long-term effects of the COVID-19 pandemic are going to be very long-lived, and I can only hope that in amongst the the conversations that you have today and the message that's been sent to our government is that we're looking at what are the preparations, not just for getting us out of lockdown, but also what are we going to do in the years following that, because there is going to be some huge knock-on effects, and in sort of preparing for that. The release of the population, and the relief that we will all have. There are going to be. We don't want to leave people behind, particularly those who've been most badly affected by it.
And presumably psychologically for a lot of children, they'll always have this with them, won't they? They'll always remember 2020 as the year that kind of everything stopped and everything paused and nothing really happened for them, and it could for some be a sort of harbinger of something worse, that it might somehow affect them in the way that they'll think, well, this could happen again, or my future could be interrupted, my present could be interrupted at any moment, and all of the things that they knew to be true in 2019, maybe they don't believe anymore.
I can only agree. I think that's probably not unique to our children. I think there's a sense of that all of our lives will be recognised that 2020 used to be a reference to sort of good vision. Now 2020 is the year that it all changed. Yeah. So I recognise that kind of further analysis of our lives.
And what about Nick, your view on the way that schools are coping with it and how they plan to cope? I've seen different sort of instructions from different schools. Different parents have sent me things. I've seen one in which they're saying that when they go back to school, kids are going to have to eat in a different way. They're going to have to take the mask off to eat, but we're not going to let them speak because that would be wrong. Is there a worry from your point of view in the medical business that schools are being a little bit too cautious and trying to kind of prevent something which is not really preventable?
I wouldn't really I don't have a clear opinion on that, if I'm honest, Mike. I think it's kind of from a point of view of the schools, they're damned if they are and damned if they don't. I mean, I think if they're following the standard advice about making sure that those who are in the education environment are, following social distancing rules, they're washing their hands, taking the appropriate precautions, and that's also it extends into how do you get kids into school safely through school transport, the meeting at school gates. I think as a whole that for what we were asking of all these educational establishments and the professionals that work within them to suddenly become public health experts, dissect down information from sort of Public Health England, I'm pretty sure they've done the best they can in the circumstances, and I personally have no individual complaint, and I only just respect what's been done in my own experience from my own children.
And what about? And I don't want to sort of ask you to go into areas that you're not familiar with or you don't want to talk about. But what about this idea that we're now going to consider vaccinating children? Obviously, there's been a conversation about vaccinating teachers in terms of trying to keep them safer. I've always said, well, if you want to do that, fine, maybe vaccinate the ones who are older before you do the ones who are younger. But is there any point in vaccinating children?
It's a very good question, Mike. And I have to say, when I heard the news, there was a part of me very pleased about it, but at the same time, I was also quite surprised. The facts are out there that COVID per se for the paediatric population hasn't been had the huge devastating effects in terms of an acute respiratory illness. We do know about some atypical infections which relate to the kind of issue what we previously would call Kawasaki's disease. I do, however, have my concerns about the long COVID situation that is beginning to see coming through in the paediatric population. And speaking as somebody who, as a clinician who has done some background work around vaccines in the past, I am very much remember the whole issue of trying to gain support when the whole issue about the MMR vaccination concerns came along, and trying to keep parents on board with that. I'm very pro immunisation, and if offered, I would be encouraging it. I just thought the actual challenges to get families and children to take part in the kind of experiments, that would be, the trials that would be required would be would maybe be a step too far. But if we can safely do it, as we have done it, so as we evidence, and I speak as somebody who is very grateful to be vaccinated myself. I wouldn't want to exclude children from the benefits of avoiding some of the more very poor and bad effects that COVID has led to.
Yeah, sure. And as far as just the final question is concerned, I mean, you're seeing obviously a reasonable number of children coming through your clinic as a paediatrician. Is it? I mean, you've sort of touched upon it already, but I mean, are you seeing anything different than say this time last year?
Well, a very strange experience for paediatricians as a whole is that because of the social distancing that we have seen in some unusual ways, we've seen less of the traditional respiratory illnesses and infective illnesses that come over the winter period. And you probably ask most paediatricians that what we call the bronchiolitis season never really happened over the winter. Now, that was because we undertook social distancing within our society, and thank God we did, because that's been part of how to reduce the COVID-19 prevalence in the community. Apart from reiterating the issue that where there are problems around mental health and anxieties, depression, low mood, that can often present in what we would call sort of non-organic symptoms. So people complaining of inexplicable headaches, abdominal pains, which is just as disabling and is just as horrible for the parents and for the children involved. And so we're obviously having to investigate them, thankfully finding nothing serious from a pathological point of view, but still we need to manage those children. So that's been a change. And of course, we have learned a little bit about the more atypical forms of COVID-19 in children, which is kind of a type of illness that I've not sort of previously seen and so severely in my own experience over sort of 25 years. But we've learned to manage it in different ways. We've had to be put in PPE. We've worn masks, and I look forward to a time when I can interact with my patients and their families without those barriers in terms of body language and just an improved experience for all. I think the children have been remarkably resilient how they've managed to get through, and when they have come up to the hospital.
Absolutely right. Well, listen, Dr. Nik, great to talk to you. Thank you so much for letting us know about how the business of looking after people is going. It's always helpful to get different perspectives on it. Dr. Nik Johnson, paediatric hospital-based doctor there, focusing on A&E as well as general wards in Cambridgeshire. Interesting. If you've got children, you'll be very, very interested to know when they're going to go back to school, what the school is going to look like for them, because, of course, as Neil Oliver was saying, One of his children out of the 3 children is going back and is very, very happy about it, and can't wait to get back and see his friends. But if they're going to be imposing all kinds of strange and unusual procedures, such as, you're not allowed to talk to one another when you're having lunch, you're not allowed to go anywhere without wearing a mask, you can only sit so far apart from one another, it's a very different picture that their kids are going back to school for. And that, I think, is worthy of some conversation as well. So let us know what you're hearing from your school, what you're expecting to hear from them, what you have been hearing from them, and what they've been doing and how they've been dealing with the kids.